The female patient was on Sunday night admitted to Kericho County Referral Hospital with suspected Ebola symptoms is under quarantine, with health authorities taking no chance as they await test results from the Kenya Medical Research Institute. The patient is said to have traveled from Malaba, a town located at the border with Uganda and Kenya. Kenya has heightened its surveillance, especially at its border points and airports, with Health Cabinet Secretary Cecily Kariuki touring the Jomo Kenyatta International Airport as a move to contain the spread of the disease into the country. According to the World Health Organization, Ebola virus, a disease formerly known as Ebola hemorrhagic fever, is a rare but severe, often fatal illness in humans. The virus is transmitted to people from wild animals and spreads in the human population through human-to-human transmission. Center for Disease Control states that a person infected with Ebola is not contagious until symptoms begin, with the time from exposure when signs or symptoms of the disease appear being between 2 to 21 days. Signs of Ebola include fever and symptoms like severe headache, fatigue, muscle pain, vomiting, diarrhea, stomach pain, or unexplained bleeding or bruising. Ebola is spread through direct contact with blood and body fluids, through broken skin or mucous membranes, blood and body fluids like urine, feces, saliva, vomit, sweat, and semen of a person who is sick, and through objects like needles that have been contaminated with the blood or body fluids of a person sick with Ebola. Ebola, however, is not spread through the air, water, or food. Although there is no approved vaccine available for Ebola, there are ways you can protect yourself against it. In any suspected case, one is advised to wash their hands often with soap and water, not to touch the blood or body fluids like urine, feces, saliva, vomit, sweat, and semen of people who are sick. Avoid handling items that may have come in contact with a sick person's blood or body fluids, like clothes, bedding, needles, or medical equipment, and also avoid touching the body of someone who has died of Ebola. In case you get sick with a fever or other Ebola symptoms, get medical care right away and notify local health authorities. So far, over 7,000 lives have been claimed by the disease in West Africa, with WHO estimating that more than 18,000 people have been infected during the outbreak. The disease has also made its way into East Africa. This week, the Ebola virus crossed from the Democratic Republic of Congo into Uganda, with Kenya too on high alert. But WHO still maintains that Ebola outbreak does not constitute a public health emergency of international concern. The first cases of Ebola were reported in Sudan and Congo in 1976, where over 284 infections were reported with 53% mortality rate. Purity Museo, Channel 1 News.